Dr. Fahad Razak is an internist and epidemiologist at St. Michael's Hospital, an associate professor and Canada Research Chair at the University of Toronto. And he joins us in studio. Great to have you here, Doctor. How are you doing?
Great to be with you.
All right, with the warmer weather finally here, everyone is getting outdoors a lot more. So let's clear up some true or false things people hear about ticks. I should mention that I should lift my socks over my pants because I feel like anytime we talk about ticks, I get a little bit itchy.
Yeah.
True or false? Ticks jump or fall from trees?
False. So ticks do not fly. They, in fact, crawl onto leaves or long grasses, and they spread through that direct contact. Let's say you're walking by the brush, the grass hits your exposed calf, and then the tick gets onto your leg.
All right. True or false? Ticks are only found deep in the woods?
False. In fact, many parts of urban Toronto where you have grass right up against houses, for example, would have exposure to ticks.
Is there particular places where we'll see them more versus not? Should we stay away from grass?
Yeah, it's hard to stay away. I think it's more important to do the appropriate precautions. So we say, when you're going out into the brush, let's say you're going into a meadow or you're going to a park, wearing longer clothing, having it well tucked in, treating it with insect repellent. And then when you come back in, doing an examination to see if you have ticks, because one of the most important risk factors of whether you get sick is how long that tick stays on your body.
And we're talking backyards as well, if you have.
Backyards as well, that's right.
True or false? Ticks can be found year-round, even in winter.
They can, and unfortunately with climate change, this is a worsening phenomenon. So our winters are getting warmer, that's objectively true. And with that, ticks can extend out their lifespan within Canada. So yes, year-round, for example, on a mild winter day, there can be ticks outside.
True or false? All tick bites lead to Lyme disease.
That's false. Lyme disease is what we worry about, but in fact, it is a rare outcome from a tick bite. The majority of tick bites don't cause Lyme disease, but because it is a significant disease, you always want to be cautious.
Are there any other diseases that we should be worried about when it comes to ticks?
Yeah, in fact, there's many diseases. We talk about this with our medical students in hospital. I won't list all the Latin names for you, but Lyme disease is one specific disease we worry about in a broader family of diseases that are tick-borne.
True or false? You will always get a bullseye rash if you are infected with Lyme disease.
That's false, but it is the most common way that Lyme disease does start. So about 80% of people who will develop Lyme disease get that first red rash, circular rash around the area where the bite occurs. But unfortunately, not all people present that way. And so this is where if you've had a bite, be cautious and look out for those symptoms like a flu-like illness immediately afterwards, and then progressive other symptoms as time goes by.
True or false? There are over 40 tick species in Ontario.
There are, but not all of them spread Lyme disease. But ticks are a very common insect, that's right.
True or false? If you get bitten by a tick, it is best to leave it as is.
Definite false. So, in fact, we know that getting that tick off your body sooner helps reduce the risk that you will develop illness like Lyme. So this is why we say immediately after coming in from outdoors, this is when you do that tick inspection. If you see a tick, then removing it with a pair of tweezers, pulling it straight out, cleaning the area with alcohol, and then checking to see if you get an infection afterwards. So it should initially hurt a little bit, but then afterwards the skin should clear up. If it then turns red or something else, that's when you should seek medical attention.
All right, I want to mention my father-in-law. He has been now, I think he has shown us photos of 6 ticks that have been crawling through his body since the weather has been warming up. And he has talked about antibiotics.
Yes.
Is that a solution? What can people do? Is that the first place that they should go if they see a tick, even just crawling on them, whether or not we know it's bitten them or not?
Yeah, no, so definitely we don't give antibiotics routinely for a tick bite. And getting antibiotics just because you've seen a tick on your body is not the right approach. Removing that tick, the strategies to prevent further ticks, long clothing, insect treatment, tick inspections. And then if you do get a tick bite and you're worried about it potentially being infected or something else, that's when you should seek medical attention. And there a doctor can help you determine, are you someone who would benefit from further treatment? Should
we be keeping that tick with us to take to a medical professional?
That's right. You can keep it with you, bring it along, show them. That can always be helpful.
All right, Doctor, thanks for walking us through that. Really helpful as we head into the warmer months. Really appreciate you taking the time to help us better understand all this.
Yeah, great to be with you.